Well, hello everybody. I'm glad you can join us tonight. We've got a special guest from England, Dr. Mark Cronshaw, and he's a professor and a researcher at one of the major universities in England. And I'm sure you're going to find this fascinating. Some of the things that we're talking about. We're going to get into a technical deep dive today that will show you more about PBM and how it works and why it can be used for so many different applications. So with that, we're going to start with our first little intro video.
15 years back, I realized that light could make a huge difference on the body. I ended up designing this very powerful light using LED technology. With this amount of very high power density, it can reach through the tissues and travel right to the joints. But the key is that the power density and the area is extremely important to deliver that light into that. The mitochondria receives that light and converts that energy into the cell. So it's like giving the cell super high octane fuel, and they run like a jet, and they're able to do all the things for repair in that. What are the products we have? Well, we have a small device, which is actually large when it comes to light therapy. You have a fairly large area of light and a high power density that can be used for different parts of the body, like your fingers, shoulder, back, neck, knees, ankle, anywhere on the body. And then we have what's called the mini canopy, which is about a foot square in size. And then we have our full-size canopy, which is basically 6 of the mini canopies. And then we have another device, which is the helmet, and that device can help for mental issues, for brain injuries, for concussions, for PTSD, TBI, all of those kinds of things. And there's new research out there that shows it could be helpful for not only strokes, but dementia, Alzheimer's, and Parkinson's, and just different brain issues. Our plans are to move this technology into every area of the world where there's pain and inflammation, which is basically everywhere, and to expand that so people understand all the applications where this technology can be used to help them in their health in the body as a wellness device. People are looking for how they can treat themselves without drugs.
I'm glad everybody could join us tonight. We got a special guest, Mark Cronshaw, and he's from England. And I'm really happy to have him on because of his experience of PBM over a long period of years and research. So, Mark, why don't you take it from here?
That's very much my pleasure. Thank you very much for the opportunity, and I'll say hello to everybody out there. I thought it'd be helpful if you had an idea of who I am and what it is that where I'm coming from. I live in a beautiful part of the world. I live in Cowes in the Isle of Wight, which is a small island off the south coast of England. And there, my day job is I'm a dentist, you know? Yeah, I'm one of those guys. I'm sorry, but yeah, I am a dentist. I'm very happy about it too. I have a great interest in lasers, light, photobiomodulation, and more recently LEDs in regards to photobiomodulation, healing, repair, and regeneration. And so just so you can see where I live, this is my dental practice here on the right. This is some of my team below, and it's a beautiful place, a holiday resort. But you can see the inside of my surgery. It's more like some sort of laboratory. You know, I got so much equipment in there. I've got more photobiomodulation equipment than you'll find in any other clinic in the UK, because I'm involved in some of the design of some of this stuff as well as in the research and development of it. And I've integrated it fully into my daily clinical practice, along with a whole host of other techie stuff, you know, so there's CAD/CAM, and we do computerized digital radiographs and all sorts of other stuff. So despite it being a very old 19th century premises, we've got a very 21st century dental practice there. Um, so you can see here a group of some of my friends who are all dentists and hygienists, and yes, dentists do have friends, and we all face the same problems. We're all dealing with people who regrettably are either in pain or have experienced pain and lost some function. And they're looking for an easy way out, and they're looking not just to stop the problem, but also ideally to reverse the effects of the disease. Plus, they want it to be something which is not too difficult for them, something which is inexpensive and something which is going to last. And there's a lot of international interest in this. For 6 years, I was a member of the faculty at the University of Genoa in the Department of Surgical Sciences and Integrated Diagnostics, which by chance is one of the world's centers of excellence for the study of photobiomodulation therapy. And this is what really whetted my appetite to learn more about this, because as a dentist, I discovered that when I was using the equipment that I use for surgery and for managing some of my periodontal problems, that the healing was just amazing. So some really fantastic results. And I wanted to know why. And so I progressively got more and more interested in the basis of what it is that we were doing, which is different compared to conventional instruments like scalpels and other stuff that we use. And I found out that there's a whole host of benefits. So what is photobiomodulation therapy? And don't worry, I don't expect you to read all this because this is very wordy, but basically it's the selective application of light, which can be a coherent light source like a laser or a different light source like an LED for therapeutic purposes. And we can direct that energy to achieve some really quite remarkable outcomes. As you can see from the figure on the right, the number of conditions medically that this has been used to target is absolutely enormous, from simple things like a migraine through to back pain, through to complications associated with oncology and post-chemotherapy and radiotherapy, a whole variety of other issues. And most of these things revolve around healing or the after effects of some form of intervention or trauma. And the point of the photobiomodulation therapy is to direct the tissues towards a favorable outcome, towards local, regional, and systemic benefit. And so the PBM is doing a whole host of things to improve the capacity of the tissues to heal, to produce more blood vessels, more matrix, more cells, a better quality healing repair, as well as to help resolve inflammation. And if you were to study more closely all the things associated in terms of conditions on that figure, a lot of it comes down to inflammation. And inflammation really is the name of the game in medicine for so many different problems, whether it's related to illness or purely related to biologic aging. And then, of course, closely related to inflammation is pain. And the management of pain is something else which, if you can ameliorate pain using a light as opposed to a systemic drug, this obviously has got enormous benefits medically for the patient. So when you look at the many most common chronic problems that adults over the age of 65 have got, it's something like 60% of them have got hypertension. A lot of them have got other problems, but many of which boil down to a source which is related to an inflammatory disorder. So if you can start to deal with inflammation, then you've got a tool there which is really remarkably useful. And this is what photobiomodulation can achieve. It is an anti-inflammatory. It works in exactly the same cellular targets as steroids and non-steroidal anti-inflammatory drugs, as well as some pretty heavy-duty painkillers, including opioids. And so if you're able to reduce the dependency of patients on drugs which are pretty broad-sword, then this is obviously a huge benefit, whether it's in my field of dentistry or the more general one in medicine. So I started my research journey 5, 6 years ago, and as you can see from the tremendous list of publications, I've been very busy publishing papers with colleagues and looking at many different aspects of photomedicine and photobiomodulation as a science, because this is a science and evidence-based approach. and it's not new. It's the research really started to gather a pace about 45, 50 years ago now. And so we've got a very large evidence base. But the rub to it is that at the point I came into this, there was the issue of the how can you best achieve the effect reliably and predictably, and how can you overcome some of the difficulties associated with the management of some complex pathologies. And so I did very extensive reading and ultimately some on the bench research, the outcome of which was, I'm delighted to say that in September, I completed my research journey with a milestone by completing my doctorate. And so this was
Congratulations, by the way.
uh, thank you.
And,
This is
and,
this
and
was for me a tremendous achievement. I think for my wife it was a tremendous relief. Uh, let's say that out of this, I'm hoping that great things will come, because from this, I developed some concepts and ideas which I'm very much hoping we can now translate into care. Which is what it's all about. So we want to take this from the bench to the clinic to our patients, because this has got such immense potential that I'm excited as to what we can do in a very gentle fashion, including empowering the public to be able to manage some of the more common complications under the direction perhaps of their own doctor, to help improve quality of life. So the issue really is, well, why do we get inflammation? I mean, it's a curse, isn't it? You get pain, you get swelling, severe cases, you can have a high temperature, there's loss of function. I mean, why is it that nature has cursed us with this thing? And of course, without inflammation, you don't get the primary signal for wound healing and repair. Now, normally after a trauma, or after a surgery, or say after some chemotherapy or radiotherapy or some other thing which could be an infection, you can have anything up to 10 days of this acute inflammatory response. And this is when you're getting the pain, you're getting the swelling, and loss of function. Now, this is then followed by a period where the repair troops are drawn into the area, because that's what the inflammation does. Without the inflammation, you don't get the healing. So people who are immunosuppressed, people who are on steroids, they just don't heal too good. And so I'm afraid you have to have some inflammation in order to draw the stem cells to the site, in order to activate the immune system. And inflammation is the essential trigger that starts the whole healing repair cascade. So you can't switch off inflammation, but you can have too much of a good thing. As for the next phase, then you're into a reparative phase where you're getting wound matrix laid down, and then it goes into a very extended period of remodeling. And what we're trying to achieve when we're doing photobiomodulation as a therapy is to reduce the peak as well as the duration of the inflammation. So there's less suffering, but that trigger's still there, to increase the volume of cells available, so you get a really good quality healing and repair up to the point of regeneration. And that can include nerves, and that the healing itself is non-eventful. And so this is all these things are what PBM can deliver as part of a well-designed and constructed, managed program, because there are many things that can upset healing, persistent infection, or systemic disorders such as cancers, various other conditions, which are all enumerated there to the left. So it's not a magic wand, but it seems it at the time, because with this tool, you've got a way in which you can reduce the amount of information you had experienced, which is associated with a reduction in the amount of pain that you're experiencing. And at the same time, you can help direct your body towards the optimum biological capacity of the tissues to heal, repair, and to regenerate. So I regard this as an exciting tool, and it works on all the different cellular types. And there isn't a type of cell it doesn't work on. And so this has got immense potential. So let me give you an anecdote. About 10 years ago, I decided that I should set myself a personal challenge. So I decided I was going to, in my insanity, cycle from London to Paris, right? Now that is 320 miles, and there's a lot of hills along the way. And on the third day, when we were about 60 miles outside of Paris, the young man on the left, who's got the bandage on his knee, was hobbling around the hotel, and he was very upset because he didn't think he was going to be able to complete his cycling challenge because he really had a very severely swollen and painful knee joint. And so I said to him, well, I happen to have this device I can use to treat your knee. And, if you don't mind, I can treat your knee for you. And he said, yeah, sure. I'll try anything. And so I gave him about a 10-minute treatment. And he said, do you know, that feels better. I said, look, pain's there for a reason. The pain may have gone, but rest it, just rest it, because otherwise you might end up traumatizing it. And so I went huffing off on my bicycle. When I got to the first water stop, there was the guy already on his bicycle. And do you know what? He cycled the last 50 miles into Paris. And here he is at the base of the Eiffel Tower celebrating completing his charitable challenge. So how about that? And because I mean, from not being able to walk through to be able to cycle 50 miles, and he looks pretty pleased about it. Here's another anecdote. This is not my case, although I instructed the dentist who treated this guy what to do. And this is a patient in South Africa, and I was very busy as an educator because I teach people how to use lasers and PBM equipment worldwide. And this particular tribesman had had a snake bite, and it just wasn't healing. And they're at the point of talking about amputating his hand, and some friends of mine that I've trained, Dr. Jacques Ferrer and another friend had the equipment with them, the same equipment that I took when I went cycling, and treated this guy's hand over about 4 or 5 days. And just look at that wound healing, And when they went back 4 months later, they saved his hand, And so this is, I think, a very dramatic example of how good biological healing can be given the opportunity, So. Here's another case. Now, this is a dentist's daughter, right? Another of my students. And she decided to take a drink from a hot tap, right? And her dad got hold of me and said, Mark, what do I do? I mean, this is my daughter. I mean, she's got really badly burned lips. And so I gave him a protocol and he treated her every day. And I said, okay, send me a picture, Mark. And 3 days later, he sent me a picture. And 6 days later, just before Christmas, sent a further picture. It healed without event. It works great on burns. So what have we done here? Well, we've suppressed the peak and the duration of the acute inflammatory response. We've reduced the amount of pain. We've enhanced the ability of the cells to withstand the insult of the burn, so there was less tissue damage, and we've avoided all of that awful extended healing and repair, which could have resulted in scar formation and could have ended up needing her grafting on her face, And so I remember her dad saying to me, that equipment, he said, and I'm afraid I'm British, excuse me for swearing, he says, it's bloody great, he said, it's bloody great. He was so happy. And in terms of my clinician wish list, anything I can use to improve the tissue's capacity to withstand stress is to be welcome, because that mitigates the after effects of my involvement. Because sometimes as a dentist, I got to do stuff where I know I'm going to trigger off inflammation, but you can't make an omelet without breaking eggs, and this is what I have to do at times. Also, if I can use this as a management tool in order to improve the capacity of the tissues to heal and repair, particularly my elderly patients, and I've got a lot of really elderly patients who just don't heal so well, then this makes it easy for me as a clinician, and also it smooths the patient journey. So here's another case. This is a child in Belgium. So this is another former student of mine, Charlotte, who said, I've got this mother whose child was injured by a dog, and she's got really nasty facial injuries, and happened 3 days ago, which is where you can see day 4. What should I do in order to help this heal? So I wrote her a protocol. She treated that child every day, and over 20 days, look at the wound resolution. There's very dramatic reduction
Beautiful.
in duration and beautiful healing. And the sweet thing about this, I do love a little bit of chocolate around the corner of a lip. It makes me smile. And this is what 3-year-olds is all about, isn't it? It's just lovely. So this is the sort of stuff, I'm sorry if you don't like dentistry, that I sometimes have to face. Yes, it's true. British people sometimes have got terrible teeth. They don't all have. If I've got any part of it, they don't. But this is the sort of stuff I see. And managing stuff like this, where there's long-standing chronic inflammation and all sorts of disease, this is a major, major challenge for the majority of my colleagues. Yeah, thanks to the integration of PBM, photobiomodulation therapy, into all the other things that I'm doing, I can do stuff like this, and it's now you see it, now you don't. That's just after a single treatment. Um, with this guy, I did crown lengthening surgery as well as some endodontics and stuff, and we went from A to B in just over an hour. The bottom picture shows that black area where there's bone loss, and we treated it using PBM after the infection was removed. We got fantastic regeneration of the bone, so this is a very powerful tool, which if used as part of a directed approach to management of care for a professional surgeon like myself, is just terrific, because we're amplifying and improving the capacity of the tissues to heal. So when I got interested in this from a scientific point of view, I went looking for models and good scientific models to test out various ideas. And so I looked in literature, and I found in the dental sphere, orthodontics is a good example. Now, anybody here who's endured orthodontics knows that it can be painful, And the reason for the pain is when they apply the arch wires or the separators, which are those little blue things you can see in the picture on the right. It compresses the gum tissues, and that triggers off sterile inflammation. And it's that sterile inflammation which is the trigger then for the whole process associated with the tooth moving, the removal of the bone and the deposition of the bone on the other side. But that pain, it peaks at about 24 to 36 hours, and that can be a big problem for some people. Now, that graph below, the top line, that's in the study where that's the control. Nothing was done there. That was the kind of pain they were getting. And that scale shows they're getting up towards 7 on 10 in terms of the pain scale. So these people are really suffering. The middle line is an interesting one because that's a placebo. This is where a fake laser was used, and people think it's going to help them. And sure enough, it did, but not sufficient to completely remove the problem. Whereas the bottom line, which was the active intervention, which was the photobiomodulation therapy, there was just zero pain. So this is really great study because that shows that this is very clearly an intervention that worked, where reliably and predictably, sadly, you're going to get pain. But if you apply the PBM at the time that you do your arch wire adjustments, the patients don't get any pain. So this started me thinking, well, when's the best time to do PBM? Is it after the event or before the event? And and I also thought, well, in terms of healing, is it best to pre-treat the tissues or to treat them afterwards, or perhaps to do both? So I came away with more questions than answers, but at least I saw that for pain relief, this would seem to be an effective measure in this scientific model. So when I looked for a further model, I then looked at cancer studies, and I've been working with an oncologist in Nice, who's a world authority on PBM, Ronnie Jean Bonzadoum, and he's a world authority on a condition called oral mucositis. And this is where patients suffer terrible oral ulceration consequent to certain types of chemotherapy, and it can also be associated with radiotherapy for head and neck cancers, as well as some stem cell therapies and various forms of leukemia. And this can be major debilitating to the extent where they may have to discontinue treatment. That can affect mortality, as well as very much complicating the management of the patient. Now, this is a level 1, which is the highest standard of evidence-based, accepted, scientifically proven process for photobiomodulation. So this is a concrete international standard. So I thought, well, I'll do my own study and do my own analysis to see if I can work out some of the best ways of approaching this, because I can see that this works, but there are questions about the timing, the intervention, and which devices it was best to use and things like this. And what I discovered was that the single biggest difference was the timing of the intervention. So if you did it before or coincident with the chemotherapy, the radiotherapy, there was no problem. or very little problem, whereas afterwards it could help in healing. And there are other aspects related to the tools that we use, whereas if you use a device which has got a big beam, something which has got a good size, spot size of light, then it would produce a much better effect. And if you use something, it's just got a little pinprick of light. And so that suggests then that the best approach to get the best outcome based on the science was that. And there was an evidence to indicate it could help reduce pain. So I then wrote an algorithm, and that algorithm was designed for clinicians based on the recommendations from the Multinational Association of Cancer Care. But I introduced this concept of pain relief for oral mucositis because at that time there was no consensus on how to manage pain. So having drawn from the other evidence bases, I then proposed this as a solution. And if by following this cycle, I suggested this might help. So the case on the left is another of my students who is a hygienist in London. She had a patient come in for a hygiene appointment who had terrible oral mucositis on the side of her tongue because she was undergoing chemotherapy. And so I said, okay, right, well, this is how to do it. Just follow this algorithm. So she used the higher energy setting to reduce the pain. And she treated her a couple of times during the week. And you can see the picture on the top and the right, but it looked like it had been a week. And then she carried on the therapy in a lower end setting. And she carried on seeing that patient in anticipation the day before each one of her chemotherapy sessions. And from there on in, she just didn't have a problem. So that's a very successful intervention. And this was very much in line with my expectation. So when you're thinking about, well, how the heck does this work? This is where it can really start to get head spinningly complex, unless you're a nerd like me, And I'm afraid I could really get terribly dull talking about biochemistry. But essentially, what you have is a little package of energy, which is an electromagnetic field, this little bundle of electromagnetic energy. When it coincides with some biological tissues, it can produce a variety of effects. It can trigger some chemical effects. It can generate a little bit of heat. It can generate some electricity. I mean, everybody thinks that Einstein got his Nobel Prize for his theory of relativity, but he didn't. He got it for the photovoltaic effect. He's the father of solar PV. And we knew right from the beginning of the last century that if you shine a light onto metals, you get generate electricity. But it's the same inside the cell. And if you irradiate the cell, inside of the cell, there are elements, metals and things, which will then change their ionic status, and you end up with electron flow. And that's something which can help drive various cellular processes, which can then optimize the cell's metabolic processes. Or you can have fluorescent effects where you can illuminate a target, a mitochondria, which is like the basic energy unit inside of the cell, and it'll then fluoresce and it'll issue another photon, which is of a longer wavelength. It's what they refer to as a red shift. And those biophotons are thought to be important in triggering mitosis, which is division of the cells, as well as having possibly some very profound effects in axonal health. So this is nerve health to do with repair and regeneration. Or you can have photomechanical effect. The effect is basically the expansion generated by the absorption of that energy produces a physical disruption of the membrane, which can change its activity. Or you can even have a photomagnetic effect where if there's iron present, and iron's present in many important enzymes, you get alignment of the dipoles in response to that electromagnetic field. So it's working on many different pathways, and so it all gets just too complicated for words. But the upshot of all this lot, based on my research, was I realized there were two dose windows, right? There's a low dose window, which is associated with healing, repair, and regeneration. And then there's a higher dose window, which is associated with the suppression of pain. And this is an evidence-based approach. So I thought, okay, so I've now got some numbers because when we're thinking about dose, we can deliver the energy in certain packets of energy, which we refer to as a joule, to an area. And if you get the right dose, then reliably and predictably, you produce the right effect. And I thought, okay, as a clinician, we're really getting somewhere. I can start to prescribe. It's like prescribing a drug, 250 milligram amoxicillin 4 times a day for your infection. And so I thought, well, okay, so the low dose, what's it doing? And it's producing all sorts of beneficial effects, so that it's promoting cellular metabolism. But the high dose, where the cell goes into like a stasis, this is beneficial in that you can trigger off what's known as a hormetic response. And the hormesis is where it's a natural defensive response to a stimulus which could be harmful. So this then primes the cell to produce more protective materials such as heat stress proteins and other protective proteins. So next time you have that insult, it's better able to withstand it. And this is the basis, I think, in part of this concept of preconditioning. This may in part be how we can help patients overcome some of the issues related to, say, radiodermatitis, where the skin can really get burnt as part of their radiotherapy. And also along the way, it's associated with analgesia, which is pain relief. And so these mechanisms have undergone quite a bit of scrutiny. And I wouldn't say we've got all the evidence-based trials there, but we do have a practical handle of what it is that we need to do in order to achieve the effect that we're desiring.
Mark, just hang on. Can you go back to that slide for a sec?
Yeah.
You're going to talk about it in the next slide, but I was just going to say that I know some people that I've had some discussions about this, and that is, if you're trying to treat, this is more shallower treatments where you can, if you apply, let's say 5 joules per square centimeter, you know what you've got if it's very shallow. But if you've got to go through some tissue, you're going to have much, much higher levels at the surface in order to get at the target level. And I just want to clarify this because I know some people are saying I'm a heretic because I was saying that you need much higher levels of, but no, this is according to this curve. If you've got deep sections, if you're dealing, and I would you agree that it's probably because dentistry was the first adopters of light therapy, that you're talking not necessarily very deep. If you have lip lesions or you have things on the inside of the mouth and you're able to put the light directly on it, you don't have much depth to go through. But if you,
Absolutely. I agree with you, Tom. I mean, we dentists, we get it easy, because everything's either on the surface or down to about a centimeter. And we know from the optical studies what the attenuation, which is the energy loss, is going to be for particular types of wavelengths and sources down to those depths. So we can then step up the dosimetry. And but I love the way your mind works because you're prescient as to what follows next. Into those thoughts. I love them. Now, so this is a 3D section through somebody's jaw, and I'm showing exactly that. I'm using 10 times the amount of energy at the surface necessary to achieve stimulation. And I'm achieving simultaneous effects because it's a 3D thing. And this has been one of the flaws in the studies in that they've used either tissue culture or small mammal models and tried to scale it up. When you're dealing with people, they're bigger, and it does take a lot more energy to be able to deliver energy to depth because of attenuation. That attenuation is due to what we refer to as scatter, where the energy gets diluted through the tissues, and also through absorption, where the energy gets absorbed by various cellular targets. So you can achieve both effects simultaneously, and this can actually be really useful. So if you've got someone who's got a superficial infection, say somebody's got a herpetic lesion on their lip, they've got a cold sore, and if you use enough energy in the surface, you'll kill the virus and you'll relieve pain, which is the analgesia. Because of the attenuation at depth, you're stimulating all the repair cells, including the immune system, so it heals beautifully. And it's now you see it, now you don't, And so this concept of the three-dimensional dosimetry, this is where we're all starting to get a good deal more sophisticated in terms of our modeling, because we're moving away from the laboratory and moving to people and clinics. So there's this double aspect of conditioning. This is the Greek god Janus, is two-faced. And on low dosimetry, this is going to improve the resistance of the cell to stress because it's in an ideal oxidative state of metabolism. It's producing tons of ATP, which is the basic energy currency for the cell. And it's a very active cell. You know, the immune system's more active, you're generating more matrix, it's much more resistant to stress. On higher dosimetry, then the cell puts itself into a temporary form of stasis, so it doesn't fall victim, as it were, to the stress that you're applying, which is the high dose PBM. But it also triggers off very important gene transcription changes. So next time you introduce that stress, so the cell's ready and it can more readily and rapidly respond to the stressor. And there's a whole string of aspects of the high dosimetry, which is associated with this hormetic response, which then results in analgesia, which is pain relief, you know. And this is what we're desperately searching for in modern medicine, never mind in dentistry, is a better way of relieving chronic pain syndromes. And this light is a way of achieving that. And we're beginning to understand how better to apply it to achieve the effects that we're seeking. So does it need to be a laser? Well, I came in this as a clinical dentist who used surgical lasers. He said, hey, things heal really, really well. You know, and it was lasers this and lasers that. And I thought, this is great. You know, I've got a tool. I viewed LEDs, you know, so I thought, wow, you know, and an LED, is it really the same? And I thought, then about a year ago, I had my sort of road to Damascus moment where I thought, hang on a bit, maybe I got this wrong, you know. And I attended some really great congresses, including the one in London recently.
Yeah, that was
And
great.
I
That was a
studied the
great event.
evidence base. And there in the picture, you can see on the left was my friend, Professor Stephen Parker. In the middle is Professor Juanita Anders, who's a world authority on pain, and myself, you know. And we were in discussion about PBM therapies. And I started to take a lot more interest as to what LEDs can do and how they can possibly work. So the guy in the picture below, that's actually my brother-in-law, who I donated one of Tom's palms to. He loves it. He's completely and totally addicted to it, you know, and he's using it for all manner of things. He's very physically active and fit, and so he's forever damaging his arms and his knees and his joints, and so he's very actively applying his palm appliance, and he finds it's very effective in mitigating pain and helping healing. And now the benefit in regards to an LED as opposed to a laser is it's a lot safer. With a laser, it's such an intense light
Yeah.
source. If you haven't got optical protection on, you can be blinded permanently. Whereas with an LED, although it's never a good idea to look directly into any bright source of light, including the sun, the risk is very, very much reduced. And in the visible spectrum, you blink inside of about 0.25 of a second, and so you're not going to go blind. And so long shorted is it's safe, and it's also a good deal less expensive to build as well. You know, lasers are very expensive devices, and they require a trained therapist and in a special clinic, and it's very difficult for patients to access. You know, and this is wonderful technology, which, as my brother-in-law was demonstrating beautifully there, it should be available to the consumer, you know. And so this is a way in which possibly on prescription from your doctor after diagnosis, or maybe you can access one yourself, but with care, you know, because you want to know what the condition is before you treat it. Then this is a way which more people can start to access a device which can add some quality to life. So I'm intrigued with LEDs now, and so I did a study at the PVM meeting where I was looking at some relatively cheap devices that you can buy in places like eBay and Amazon and stuff. And as they were making great claims, you know, and yet there was very little evidence base there. So I did a study which is currently going through peer review looking at these little things because they were claiming you could sort of cure anything. And I thought, well, where's the science? And actually, there are no direct scientific studies to support this particular type of device. And I thought, well, this isn't good, because I mean, patients have been asking me about these things, and colleagues have been asking me about them. And I thought, well, what can they actually do? So I did an analysis on a bunch of these things. I thought, well, potentially, given some serious direction, there is potential for this type of device. But in the format they are at present, then I would be very wary about recommending them to my patients, because we don't have the studies in. Plus, the instructions that comes with them, frankly, are so vague and useless. And the design of them, it's like buying an original Model T Ford instead of a decent car. I mean, yeah, it'll get you about town. It's likely to break down a lot. And the long and short of it is that there are many failings associated with these devices. But in my reading of the broader literature, I found that LEDs can work. And yet I thought this is impossible, because I mean, there were studies like this, and I don't expect you to read all this, but basically what this is saying is that the optical transmission of the laser light is substantially greater into tissues than that of an LED. With the LED in this particular study, at a centimeter deep, they were only getting between 0.1 through to about 0.6% of the surface energy arriving at a centimeter in depth. Whereas with laser, I'd expect 10 times as much. So I thought, this cannot possibly work. Yeah, I thought, but it does, because we've got the studies in, some amazing studies now looking at things like fibromyalgia, as well as some of the transcranial studies looking at Parkinson's disease and various other central nervous system disorders. And there's a lot of other indicative studies that suggest that LEDs will work. So I thought, well, how on earth can this be? Because the photons aren't actually arriving at the target. So I then had to go back to the drawing board and start to rethink this whole thing. And this is what I've come to think. And I thought, well, okay, there's your LEDs. It's just at the superficial level, the epidermis and the dermis. It's not getting through to the deeper sources. I've got some pretty pictures at the bottom there where I use the device to actually measure through samples of tissues exactly what the tissue penetration was. I can see the photons aren't getting there. Yet we're getting the benefit. I mean, what is this, And so I then went back to the literature, and I remembered an old study I'd read some years ago about melanocytes. Now, melanocytes, so these are the cells that produce melanin, so you go out in the sun, you get a tan, that's melanocytes. But melanocytes themselves are very interesting cells because they're actually derived from the same cell line that the whole of the peripheral nervous system comes from. And so really it's almost like a specialized form of nervous tissue. And they don't just produce melanin, they also produce a whole variety of other things, including some very important neurotransmitters like serotonin, noradrenaline, dopamine, a whole bunch of hormones, including human growth hormone, adrenocorticotropic hormone, prolactin. The effect after exposing skin to light is that you get a peak which can carry on for 3 hours or more. So we know that on a bright sunny day, everybody feels good. Well, here's some science to explain why. Because I mean, serotonin, this is the happy drug. Hey, you feel good. You've got plenty of serotonin. You're bright and awake. Noradrenaline, this is something where you're really pumped. Dopamine, this is all part of the reward behavior. I mean, when you got dopamine, yeah, you want to do it again. As for these hormones, these are very important in regulating some very important aspects to do with healing and repair. So at the level of the epidermis and dermis, which is the superficial layers of the tissue, an LED can be activating the melanocytes to produce all of these important effects. And these will be producing not just an effect on the cells themselves to produce these mediators, but they'll be producing a local effect as well as a systemic effect. And that's exciting to me, because it helps me give some understanding of how it is this superficial light can be, which is very gentle, can be producing some deeper effects. So I thought, okay, well, let's go deeper. So I thought, well, what examples are there of electromagnetic energy producing generalized effects? And the obvious effect there is in the circadian cycle, because you know that light at night can disturb your sleep rhythm. Anybody that's traveled long haul knows that when you change time zones, it really upsets your body clock. And the science there is that there are specialized receptors at the back of the retina which inhibit the production of a substance called melatonin in the pineal gland. And this is the thing that sets the biological clock between the hours in which your sympathetic nervous system is active, that's the daytime wakeful period, and the time when your parasympathetic nervous system is active. And this is when you heal and repair. And so, at night, I don't have much of a beard, and I wake up in the morning after I've been sleeping, my beard's grown, because that's the time when you heal and you repair. So, light has entrained the circadian cycle. Now, this idea of the philosophy of entrainment is where you have an electromagnetic source, a light, which is an oscillating source, and it's interacting with another oscillating source, and it then sets a resonance, which then sets a harmony, which then sets the machine. And so if you carry that concept forward and think about photobiomodulation therapies, there are very many light sensitive targets inside the body. I mean, if you look at those two maps there, they show all the different organs and tissues which are light sensitive. And so, although we've only got two eyes, the cell walls themselves contain many important ion gates called opsins, which are photosensitive, and there are many intracellular items which also are photosensitive. And then most recently, within the past 4 or 5 years, we've realized that myelin, which is the outer sheath of the nerves itself, can transmit photons. And that this is a natural pathway for biophotons, which are these fluorescent re-emissions of light. But there's the intriguing possibility this may offer a highway for surface application of light into via the myelin sheaths into deeper tissues.
Just
So
be, just before you go
phototransduction.
further, just before you go further there, one other thing that is the bone people have asked me, and actually bone can transmit light fairly well. And we talked about that a little bit on another occasion, where light can go through the tooth and stuff.
Well, yeah, I mean, enamel and dentine, the structure of it, enamel has got prisms in there, and they just act like an optic guide, and dentine has got dentinal tubules, which again act like optic guide. I mean, I've got some lovely video footage showing this, where you put an LED into a tooth, and you can see it being transmitted through the root, and it's is acting as transmitting. Similarly, hair. If you've got a type of hair called velous hair, which are very short hairs, the light can go down the hair shaft down to the bulb, and you're delivering photons then into the dermis. And they say the same for white hair. It doesn't happen for pigmented hair. And this is a suggested mechanism associated with the seasonal change in fur color of some mammals and things. And I think there's a lot more happening there than we realize, in terms of the pathways. Because I mean, historically, it was very much a photochemical approach, where we assumed, according to the first law of photobiology, what's known as the Grothaus-Draper law, that you had to deliver a photon to a target to produce the effect that you're seeking. But there are many, many different other pathways where the photons are being transmitted. It's not just by direct transmission. It can be transmitted through to cells, which are in the superficial layer, which then start to produce some endocrine as well as paracrine and cytokine changes, as well as through other routes, such as perhaps even along nerves. I mean, I think it's fascinating that one of the areas where there's considerable success in LED therapy at the moment is the transcranial stuff,
Yes.
where they're using helmets and things, and I know that Tom's got a brilliant device. I mean, I just love this helmet, I want one, Tom. And it really is a tonic, but I mean, for a therapeutic application for conditions such as Parkinson's and
I didn't
for
turn it on. There's the real effect.
and these things. I mean, these are all still undergoing scientific evaluation, but the way in which this may be working is the transmission of that light along the myelin into the deeper tissues of where it's needed. So I think this is extremely exciting because the possible range of therapies we may be able to evolve from this are very considerable. So there's an overlay of direct action of the photons and interaction with specialized cells. You can have some photothermal effects, low-grade temperature changes, which can trigger off some hormetic responses as well as improving circulation and maybe associated with analgesia. And then there are all sorts of other pathways involved. So although we know a lot about it, I don't think we've got this one fully taped down yet, but we certainly know from a therapeutic point of view what works and what doesn't. So, because from the applied practical side of this, we're enjoying a lot of successes. What we haven't gained yet is sufficient randomized clinical trials to be able to satisfy all of our mainstream medical colleagues. But the water's lovely, and I can't help to welcome them in, and I'm excited as and when they do, because this is non-toxic, it's safe, it's something which I view as potentially highly effective, providing it's used within the context of a joined up approach to therapy, because it's not a magic wand, and although it will seem like it, it does need to be used deliberately in a manner which will best do it. But I mean, from point of view of everyday people, I can see us all one way or another having home therapy LED device. Along with the elastoplast and the bottle of Dettol, you're going to have light. And yeah, because this is just too useful for to miss the kind of benefits you'll achieve, particularly if you get the right advice. And this is the rub. It's like the Wild West out there at the moment. There are so many Chinese manufacturers and distributors selling a load of stuff out there, and not much of it is really that good. Whereas there are other decent ethical manufacturers like Tom and others who are producing well-designed equipment, which is really medical equipment. And so I fully support everything that you're doing, Tom. I'm very impressed
Wow,
with what you've
this has
got.
been
So just in conclusion, you can see me there in the laboratory. There I am with some of my research friends, without whom I wouldn't have been able to do anything. But um, from this mishmash of information, I'm sure there are far more questions than answers, but hopefully it'll provoke some thoughts amongst you, because I mean, this is a very real technology. I regard it as the single most exciting development I've seen in modern medicine, never mind in dentistry. And it's a revolution. It's in progress. It's happening, and it's going to help us all.
Yeah. Thank you so much. This has been phenomenal. I'm sure there's going to be a whole pile of questions that come from this presentation. And I know we could probably go on for part B, but what time is it in England right now?
It's 11 o'clock at night.
You're, I hope you get a really good sleep in.
Oh, I
But you
will.
know what? Use
I'll be
that light on your acupuncture point over here, and it could help keep that sleep going. So
well, I'm going
this
to
has
say
been fantastic. Thank you
it's
so
been very
much,
much
Mark.
my pleasure. Thank you, everybody who's had the patience and to join me. It's been my pleasure to share with you this, and hopefully we'll get to meet again sometime.
Thank you. All right. All the
Okay.
best. Well, that is a lot of information. I, I like one of the responses tonight from Bill. That's bloody excellent. That's awesome from Susan, and we've got a lot of good feedback right now coming from this tonight. Wow. Um, we literally could have gone on for another hour. He was ready. So, anyways, that was great. That was great. So, I think what we're going to do, we're just going to quickly talk about a couple things here. So, as we put out in the slide before, or you saw it happen there. This is the helmet, and it has the 660 nanometer wavelength and 810. As you can possibly see it there just a little bit, or this is the super helmet, so it's got the 1050 in there. So if somebody wants to get the 1050, we have that as a premium item because the LEDs cost us a lot more. Anyways, we for the norm that's 10 of these palm lights, and we have the palm is we have the 660 wavelength and the 810 nanometer wavelength that you see here, and we also have the super palm, which is has the same 660 nanometer wavelength and the 1050. So that's the super palm. And I'll just mention here we have the mini canopy, which has the 660 and the 810. You can't see it very much, but it's there, or 1050. So those are our different devices that we have, and we also have the large canopy, which is 6 of the mini canopies. So the mini canopy, the nice thing about it is basically like 15 of the palm lights in area. We have a considerable optical power. Want to mention as well, we are coming up to Black Friday, so we are going to give 10% off up till Black Friday, and that the code for that is, as you can see in your comment sections, BLKFRI 10W. So that's BLK Friday FRI 10W for a 10% discount on any of our products. So there's a question about bone loss coming from Carla. You can, it's very interesting that you can create, you can use the light to actually help with stem cell production, and on the large bones where a lot of the stem cells are created. There's other questions here. I see we're really late in the evening here. I will address a couple of these questions by email, and I'll just 1 second there. I just want to go back up here. The reason we couldn't have them on live tonight, obviously, is because of the time difference. So let me just check one thing here from Brian. Dr. Cronshaw, thank you so much for sharing your R&D data on PBM. Absolutely gobsmacking research. Tom, my question on your PBM tech is a very personal one. Okay, I think I will address that separately as well. So we do have your emails, and we will respond back with them. So to you. So listen, to everybody, have a great evening or and a great week till we resume again next Tuesday. And there's one more. Well, there's still some questions, but okay, we don't have it. Oh, there it is. Excuse me for 1 second here. Question was that, can you show the intraoral device? We have this device here that allows you to there we go. So what it allows you to do is put the light down a tube just by snapping this into the unit, and now you can put the light inside the mouth at the area you're trying to treat. So you can see how that works very, very nicely, and you can do either one of the wavelengths that you have. When you switch it one direction, you put it in one of the holes, and you need the other wavelength, you put it in the other one. Okay, I think we're gonna call it quits for the evening. Remember to join us next Tuesday, and please make sure you tell your friends about it. And also, every time you join in, you have the chance to win an ultimate. That's one of these devices, the $1,300 device, and once a month we take each time you've watched us, we put you in as a ballot. So if you watch us 4 times, you get 4 ballots put in. At the end of the month, we do a draw and give away one of the ultimates. So anyways, all the best. God's richest blessings on all of you. Bye for now.
15 years back.